Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Thank you for joining our functional medicine discussion group meeting tonight with Dr. Peter Bongiorno on an integrative approach to depression and anxiety. And I hope you'll consider joining some of our upcoming meetings. December, we are not going to have a meeting, but January 27th, Dr. Aristo Vashtani will be joining us on why we should test the immune system. And I've yet to fill out the rest of the schedule for next year, so I better get going on that. I encourage everybody to participate in the discussion by typing your question into the chat box, and then I'll either call on you or simply ask Dr. Bongiorno your question when it's appropriate. If you're not aware, we have a closed Facebook page, the Functional Medicine Discussion Group at Santa Monica, that you should join so we can continue the conversation when this evening is over. I'm recording this event and I'll post it on my YouTube page, and I'll include it in my weekly Rational Wellness Podcast. If you haven't listened, please check out the Rational Wellness Podcast and subscribe on Apple Podcasts. And if you enjoy it, please go to Apple Podcasts and give me ratings and review. I want to thank our sponsor for this evening, Integrative Therapeutics, which is one of the few brands of professional supplements that we use in my office. And so I'd like to welcome Steve Snyder from Integrative Therapeutics to talk to us a little bit about a few products. Steve?
Hi, everyone. Thanks, Dr. Weitz. I'm so excited because finally the topic is something we actually have something that's pretty unique. Not the only time it's ever happened, but this is really good. And so the Zoom is telling me that you've disabled the sharing. Here, no. Let's see. There you go. Okay, you should be able to share now. Okay, so just real quick, we actually have a product called Lavella that's a oral lavender essential oil, and it's got some really pretty impressive research in anxiety. What's unique about this is it was developed by our parent company in Germany, and if you know anything about supplements in Europe, you have to do some pretty significant clinical research to actually sell something over there. And this happens to be a lavender that we grow ourselves. You can see from the name here, WS 1265. The WS is for Wilbur Schwabe, and he happens to be one of our owners, and also a pretty smart guy. So he developed this Lavella is what we call it in the States. Selexin is the trademark name, and it's got some really, really great research in anxiety. So it's significant anxiolytic efficacy comparable to lorazepam and Paxil. So we've seen some great benefits associated with anxiety disorders, disturbed sleep, and other somatic complaints, stuff like that. It's non-addictive, non-sedative. There really are no side effects other than people tend to burp lavender. That's supposed to go away, but it is a thing. There's a school of thought that maybe that olfactory part is part of the efficacy. Some people like it, some people don't, but it tends to go away. And kind of here's some of these are kind of the two big studies we talk about. And it's probably hard to see for you guys, but basically the one on the left is comparing Lavella with lorazepam. And this was 77 subjects over 6 weeks. And you can see we basically had a similar reduction in symptoms, and we had a similar response rate as well. So as you know, the benzodiazepines and some of the other pharma stuff doesn't work for everybody. We see about a 75% response rate with Lavella. So when it does work, it's awesome, but it doesn't work for everybody. The subject on the right is compared to Paxil, and that one was with 539 patients, so a pretty big study. At 10 weeks, and we saw the same thing, similar results, no side effects. And people always ask, how does it work? And this is one of those things we're not 100% sure, but what we believe is that it helps modulate the presynaptic calcium channels. So it's regulating the release of neurotransmitters, and sort of modulating that response and lowering anxiety through that mechanism. We see typically 1 to 2 caps per day is all you need. We like to let people try it for about a week if we're going to do a trial. Some people say they feel it right away. Like I walk into offices all the time where they say, oh, I just took a Lavella, I feel great. And that's awesome. I'm not going to argue with them, but it really doesn't work like that. But if they feel better, that's good too. So if people want to sample this product, we do let people try it. We have boxes that have 10 caps in a blister pack, and that's typically what we have them give a patient. So we want to make sure somebody gets a response before they spend the money on it. And then there's a whole bunch of studies on it. It's about over 1,000 patients now. So everything from those studies I just showed you to against placebo. There's also some open label dose, 180 milligrams versus 160 milligrams. So it's a pretty heavily clinically studied product. And so far it's one of our flagships. People ask how much. It wholesales for $35 for 60. So for some people that's 2 months. For others, it's 1 month, but still relatively inexpensive. And it's available everywhere. So we love Emerson and Fullscript, but we also sell it direct. So if you want to try it, you can email me at steve.snyder@integrativepro.com, and we can send you some trial boxes. So that's the Lavella. And then the other one I really quickly wanted to mention was Theracuramin, which is our high bioavailable curcumin preparation. It's essentially a water dispersible curcumin. So we get really high blood levels very quickly that last for a long time. And the reason I bring it up in this context is there was a recent study done at UCLA where they looked at men with age-associated memory decline. And they weren't really looking for mood response, but the metric they used to check the memory also had a mood component to it. And they noticed a significant improvement in mood over the course of the study in these guys. So Theracuramin is kind of, there's a lot of claims being made about curcumin out there. We call it the curcumin wars. We happen to have something that we can back up where a lot of people will say stuff and then they can't back it up. So that's another one we'll let people try. There's all kinds of clinical studies now on it because the pharmacokinetics is pretty well established. So everything from mood to skin health to liver function to cardiac function, we're trying it everywhere. And we're putting it in a lot of stuff because with a lower dose, you can get some clinical results. So that's pretty much it. Thank you.
Thanks, Steve. And so now I'm going to introduce our speaker. We're very happy to have Dr. Peter Bongiorno speaking with us this evening. And he's a naturopathic doctor and acupuncturist in New York City. And he also works with clients via phone and Skype. He's written a number of books, including Healing Depression, Holistic Solutions for Anxiety and Depression in Therapy, which is this book here. And this is like an incredible resource, really dense with tons of information. So I refer to it regularly when I have patients with depression and anxiety. He's also written How Come They're Happy and I'm Not, and Put Anxiety Behind You, the complete drug-free program, both for patients. His website is drpeterbongiorno.com. That's DRPETERBONGIORNO.com. So, Dr. Bongiorno, you have the floor.
That's a long name. I started getting bored while you're. Oh, thank you. Thank you so much for having me here. It's really a pleasure.
Good. So how do you want to get started?
Oh gosh. We could start with let's start with what's going on right now.
Okay.
I'm
Is
actually.
is there anything going on right now?
Not really. It's pretty.
Nothing to be worried about.
No. Yeah. In fact, right now I'm actually preparing a talk for, I don't know. Do you come to the Integrative Healthcare Symposium in New York City?
I haven't been to that one yet.
Haven't been to that one.
Yeah.
So it's, it's one of the biggest integrative medicine conferences there.
It's in February. Is that right?
Yeah, it's in February in New York City. Maybe Steve will be there. Okay. I don't know if Integrative ITI will be there, but
we'll probably have an army there.
Great. Yeah. I'm sure you guys will. And you definitely need to be handing out Lavella and some Cortisol manager while you're over there.
Yeah.
So actually I'm preparing a talk right now for that conference, and it's going to be about COVID and mental health. And, because it's just extraordinary what's been going on in the past couple of years, the incredible increases in both anxiety and depression, like 6, 7, 8-fold, I think it was at its high point in January of last year, or up to 42% higher rates of depression and incredibly higher rates of anxiety. It's lowered a little bit, but still way above.
Dr. Peter Bongiorno.
Yes.
Oh,
hello.
Sorry.
Oh, that's okay. And so really, anxiety, depression has skyrocketed. Drug use has absolutely quadrupled. Suicide rates. There's so much to be done, and you could say, well, it's the stress of COVID, and I think that was a part of it. But I also think it was, a testament to just the dis-ease in our population, the unhealthy lifestyles and the just the general inflammation that's already been in our bodies. And then something like this comes up and just, sort of the straw that breaks the camel's back. And so for people who are already predisposed, it's going to really increase these rates. So that's something, especially in New York, that I've been seeing a lot of, practicing in New York City. It's been phenomenal. It's been quite an education. And
I think that's something a lot of us in functional medicine, integrative world have been talking about, which is not getting talked about a lot, which is the fact that so much of our population is so unhealthy to begin with poor diet and lack of exercise, and the incredible high rates of people being overweight, over 70%, and high rates of diabetes and pre-diabetes and hypertension and on and on and on. And those are the things that can play a role in predisposing us to depression and anxiety, and also increase the likelihood we're going to have a worse case of COVID if we catch it. Low vitamin D levels, lack of sunlight, and of course, keeping everybody inside, not exercising and not getting exposed to the sun, and et cetera, unfortunately probably makes the situation worse.
Yeah, no question about it. So that's one of the things that I've been working on right now, is really putting together the information regarding, the factors involved and why we're seeing these incredibly increased rates of anxiety, depression, suicide, drug use, domestic violence, all of these things.
Right. So I'd like you to talk a little bit about the neurotransmitter theory of depression and anxiety. Mm-hmm. And, as we know, there are huge numbers of people on these medications.
Yeah. So, so when you work with a conventional psychiatrist, and let's say you have depression and you go in there and maybe you start crying, or you're emoting some kind of, thought, usually a psychiatrist will think to themselves, okay, well, there's probably low serotonin, maybe low dopamine, maybe low norepinephrine. So let's give a drug and let's try to increase those levels of those neurotransmitters. And in the case of something like anxiety, it works a higher percent of the time, maybe 60, 70, possibly 80% of the time when you give drugs like that. Of course, as Steve had mentioned earlier, those drugs are addictive and they tend not to work over time, and they can have sedative effects and other problems, which is the reason why if you have something like Lavella, which has been shown to be as beneficial without those kinds of effects, it's certainly worth trying something like that, right? And then you have depression, which antidepressants, especially SSRIs, which are the mainly prescribed antidepressants, work maybe 30% of the time, maybe a hair above what placebo has been shown to use. And then we do have natural remedies, things like St. John's wort, saffron, curcumin, which also Steve mentioned earlier as well. And those have actually been shown in individual studies head to head with those medications to work equally as well, at least. Now, of course, equally as well still only means like 30, maybe 35% at the most, right? So the question really that I have and what I think about when I work with patients is, if it is a neurotransmitter issue and those drugs work, why are the neurotransmitters off? And the other question is in the the percentages of patients that they don't work, 30 to 40% for anxiety patients, upwards of 70% for patients who are depressed. What else is going on? So and that's really, I think, what I'm interested in and what I work on with my patients. So when we want to look at neurotransmitters, that's fine. And if we can work with them and use some natural, less toxic things to help them balance, that's good. But that's still not getting to the underlying cause of why they got out of balance to begin with, if that even is the issue. And that's where I like to think about, well, what are the other factors? So we want to take into account, of course, a person's stressors, which can certainly play a role, what their environment is, what their toxicity levels are, what the inflammation is in their body, how is their gut working, are they getting enough sleep, what's the hormonal balance that's happening, what foods are they eating, there's what is their mitochondrial function, and is that a part of why maybe their brain and their mood is suffering? What are their genetic makeup, and is there anything we can learn from that can help us get a better idea of how we can support their body and the pathways in their body? Are they exercising? So so even when we think about neurotransmitters and the neurotransmitter theory, which I think has some relevance and some credence, we still have to say, well, what's the underlying cause of the neurotransmitters being off, if that's even it? And then for that other percentage of patients where it's maybe not playing as much of a role, what are the other factors? Because, in conventional psychiatry, if it isn't a neurotransmitter issue and the drugs don't work, there's no other tools, there's no other choice. And that's why I love natural and functional medicine, because there are so many other tools, because we understand that there are so many other factors involved, and that it's probably just not one or two factors that are contributing to the mood issue. It's probably a number of factors that are contributing in small ways that synergistically is creating the syndrome that maybe we're calling depression or calling anxiety, as an example.
Exactly. It sort of reminds me of the issues we're having trying to deal with some of the chronic neurodegenerative problems like Alzheimer's, and they keep, conventional medicine keeps looking for this one pathway and coming up with this one drug that affects that one pathway. And after just, hundreds of billions of dollars of research, they've come up with nothing. And now we have this new drug that was just approved that does nothing to make anybody better. At best case, patients get worse more slowly, and 30% of the patients get swelling in their brain. And the first patient just died from this drug. And yet we have a functional medicine approach, which Dr. Dale Bredesen has finally published his study showing that patients actually improved. They didn't just get worse at a slower rate. And, but it's a complicated, but that's the beauty of a functional medicine integrative approach, looking at a number of different factors. And not only do you end up improving your brain health, but you improve your overall health. And the same thing with the functional medicine approach for depression and anxiety.
Exactly. Yeah, exactly. And Dale Bredesen, who did that amazing work with Alzheimer's, understands that it's multifactorial. And then you have to look at a number of factors at the same time and work with as many as we can. And I think what the conventional care model doesn't, when it comes to drugs, doesn't understand that that the body has a lot of redundancy in a sense. So when you give it a drug that works on a single mechanism, the body's really smart at saying, okay, this is foreign. I don't know what it's doing, but we're going to start working around it. So you need to give higher doses than is probably even healthy. And so you end up with more side effects and less beneficial effect.
Right.
That's the problem with the medications in general. And I certainly see that with mental health, and it's certainly seen in neurology when it comes to Alzheimer's as well.
And apart from all the other factors that we're going to talk about that affect mental health, from sleep to diet to exercise, et cetera, even a neurotransmitter theory is, just looking at one neurotransmitter like serotonin is just a huge oversimplification about the way our brain and moods work. There's a whole plethora of different chemicals that all interact in a very complex way.
Right, of course, and it's the best as far as depression goes. If I had to pick a drug that probably did work the best for depression, it was tricyclic antidepressants, and those are the old antidepressants. And what they did was they kind of raised a lot of the neurotransmitters. They raised dopamine and serotonin and norepinephrine and acetylcholine. And the problem with those drugs is that they were very they're kind of toxic. You can't give them to seniors because they're especially toxic to older people. And again, even when they work for a while and then they kind of stop working because, like I said, the body, figures out that its hand is being forced and it doesn't like that. So it kind of starts to work around these drugs. And so that's why we need such a full integrative and holistic model that really just looks at the whole person.
Now we'll get into your testing, various types of testing that you think is beneficial, but just on the neurotransmitters, do you think that's a valuable thing to do the urinary neurotransmitter testing?
Yeah, I mean, urinary neurotransmitters, I think, has some value. It's, interestingly, in New York, it's very hard to get these neurotransmitter tests because of the laws in New York. So I don't actually use them very much.
Oh, really? Wow.
Yeah, it's New York is a little toughy when it comes to a lot of these functional medicine tests. So I've actually kind of worked around them a bit, but the fact of the matter is that there are neurotransmitter tests that I think can give you some clues, but you still really need to back it up with a clinical relevance, and finding out how is this person feeling to really understand what's going on. Urinary neurotransmitters, I don't think give you a full picture of what's going on in the brain, but they can, suggest to you what's happening in terms of breakdown and metabolites. So yeah, I mean, the more information we have, the better.
So let's talk about some of the important dietary factors that can play a role in triggering depression and anxiety.
Mm-hmm. Well, the first one that I see is just blood sugar dysregulation, especially when people have high insulin levels. Insulin, will drop your blood sugar. So people whose pancreas tends to make a lot of insulin because they're insulin resistant, they'll have these wild fluctuations in blood sugar. And that certainly plays a role in anxiety and in depression. That'll play a role in triggering other stress hormones, changing levels of cortisol. And that can be very hard on the body and create a lot of stress and cause a lot of anxiety as well as depression. So that's the first thing I think about when it comes to it. So I like to make sure people are eating, trying to stay away from simple carbs so that their blood sugar doesn't go up and then come way down. And then making sure they're eating, a good amount of protein, healthy fat, and some complex carb regularly and throughout the day. And I know sometimes for weight loss and metabolic health, sometimes we need to do things like intermittent fasting where we don't have people eat for a number of hours of the day. Sometimes for people who have anxiety and depression, that doesn't work for them. And you need to kind of have them do more of a grazing approach where they're eating little bits throughout the day to keep their blood sugar stable. Everybody's different. So what's appropriate for one person isn't appropriate for somebody else. And then as far as the foods themselves go, as we know, the standard American diet is really a disaster when it comes for our health. It's a very pro-inflammatory diet, and inflammation is going to change what's going on in the brain, change what's going on in the middle of the brain, which is the hypothalamic pituitary adrenal axis. So what we eat will greatly affect how our brain communicates, with the nervous system, the hormonal system, and the immune system. And that's going to make a lot of changes in what goes on with our mental health as well. So I always, recommend people have, if I don't know a person and I don't know what their individual needs are, and I had to just make a blanket recommendation, I would probably start with something like the Mediterranean diet. Sanchez and Villegas in the early 2000s did a number of studies out of Spain, which showed how the Mediterranean diet can prevent and even treat anxiety and depression, as well as lower things like CRP and other inflammatory markers in the blood. So people who eat that kind of diet typically have lower anxiety, lower depression, less inflammation in the body. So that's a great place to start.
How do you work with vegans or vegetarians, given the importance of getting enough good quality protein?
Mm-hmm. Well, it depends. It depends on the patient, as always. If we're working with a vegan or a vegetarian, there are, there's beans, there's nuts, there's seeds, there's we can also do smoothies with it. So it depends on the person. Some people don't have as much need for as much protein. And actually, when it comes to things like even histamines, right? If people are very high histamine and they have a lot of anxiety, then typically I'll put them on a lower protein diet to lower levels of histamine. So that could actually be helpful. Okay. So, it just depends. We have to strategize individually where people are going to get their protein from.
How often do you find histamine is an issue?
I would say a good 15% of the time, maybe 10 to 15% of the time. I do run histamine on practically every patient, and I'll do, as part of my intake, ask them a number of questions to find out. Sometimes I'll have people who'll come in and they'll say, I ask them how they're sleeping, and they'll say, "Oh, I'm sleeping great." And then I'll ask them, "Oh, what do you take? Do you take anything over the counter?" "Oh, yeah, I take some Benadryl at night. It really helps me sleep great." That's kind of a clue that they're probably high histamine, people who, because Benadryl is an antihistamine. Right. If you don't have really high histamines, it won't affect your sleep too much. But if you're high histamine, boy, you get the best sleep with that stuff. So I'm not recommending it as a plan, but I'm just saying it's right. So that could be kind of a clue to find out as well. Plus, if people have a lot of rashes and itching or urticaria, where you can write on somebody's arm and, write your name on it with your finger. That's how you know their histamines are pretty high.
And will you use a specific low histamine diet?
Yes. Yeah. So there's a number of foods that will either release histamine in your body or actually have high histamines in them. So it's a little handout that I'll give people, and I'll have them start with the foods that they tend to eat a lot of. And sometimes it's even healthy foods. It could be even things like avocado, as well as, things, typical ones that people know about are wine and cheese. But even there's some healthy foods. Fish can be high in histamine. I love people eating fish. It can be so healthy for you, but if they're high in histamines, then that might be something we might want to limit.
And so we often see patients with histamine problems who come see us with other gut disorders. How important is the microbiome in the gut for overall mental health?
Yeah, so the microbiome plays such a strong role in the production of neurotransmitters, both in the gut and the signaling through what the cytokines, the immune signals that go to the brain and help the brain also, make neurotransmitters in different areas of the brain. So when there's a lot of inflammation in the gut, that's going to typically change levels of neurotransmitters in the brain as a result. And the microbiome will play a strong role in modulating that inflammation.
Now, given that the neurotransmitters in the gut don't make their way into the brain, how important is the neurotransmitter production in the gut?
Well, neurotransmitter production, that's actually something that's being hotly debated right now. Okay. And I'm reading the research on that. So there's some people, some researchers believe that it still does get into the bloodstream, and it also is in the enteric nervous system, right? So the enteric nervous system is that vast amount of nervous system that surrounds your gut, and through vagal nerve stimulation sends a lot of signals that go to the brain and then affect what goes on in the brain in terms of production of neurotransmitters and even inflammation. So there seems to be a relationship between the production in the gut and the production in the brain, even though you're right, directly, I remember when I first learned about, serotonin is produced, and most of your serotonin is produced in your gut, and that's what changes mood. And then as I learned more about it, I did learn, oh no, it's actually doesn't get to your brain though. So how does it affect it? But we think it's through those other pathways that it's not maybe a direct relationship, but it does have an influence, a pretty strong influence.
And it turns out there's a huge amount of serotonin receptors in the small intestine. And in fact, right. Stimulating those serotonin receptors actually helps improve gut motility. And so interestingly, patients with IBS for years were, because nobody really understood about SIBO and right. So IBS was seen as a psychological disorder. So patients were put on antidepressants, and it turned out that the antidepressants actually did have some benefit by stimulating the serotonin receptors in the small intestine and helping patients overcome constipation and stimulate motility. That's
right. Yeah, I think it was actually in the 30s or the 40s. I'm blanking on it. It was a female researcher that had published some studies on why does the clam, how does the clam clench down and keep that muscle so strong, day in, day out. And what she found was basically what led researchers to what they called enteramine, which is serotonin. So entero stands for gut, right? And they found that enteramine in the gut was what helped change motility in the gut. And they later renamed it serotonin. And they found that it also happened to, be in the brain and that it was a part of mood. But for a long, long time, the thinking was that serotonin's main job was working in the gut for motility. Yeah, exactly.
What about the importance of iron, for example?
Yeah, so iron, I remember when I was a student, so this must have been about 24, 25 years ago. One of the very first patients I saw was this woman with depression. And I was talking to her after her visit because she was very, very happy. And I wanted to find out, what did the clinicians do for her? I was a young secondary clinician just learning for the first time. And she said, she goes, well, I was on antidepressants for many, many years. And the head clinician there had run an iron panel and looked at her serum iron, looked at her ferritin, which is iron storage, and found her iron storage to be very, very low and her serum iron to be very low. And they gave her some iron, and no one had ever really looked at it. They gave her iron, and within a month, she was off her antidepressants after being on them for years. Wow. And that was the first time I had ever heard that there's an association between iron levels and mood. And of course, it makes perfect sense, right? Because iron is the center molecule of hemoglobin, and hemoglobin is the molecule in your blood that you use to carry oxygen. So of course, if you can't carry oxygen adequately, your body and your brain is going to kind of shut you down and say, okay, well, let's let's lower that mood. Let's shut that person down so that this way, they're not going to want to use as much oxygen. So there's much higher rates of depression when iron levels are low, and anxiety as well.
Now, you just mentioned somebody who was on antidepressants for a long period of time and got off. And that's one of the issues with these drugs, is the difficulty of getting off of them once you've been on them.
Right. And I think that's twofold. One is because when you're on the drugs for a long time, the receptors for that particular neurotransmitter, they downregulate because your body knows there's too much around than it would be doing on its own. So it downregulates some of the effects. So that's one issue. The other issue is that it does deplete a lot of the precursor molecules that you need to make the neurotransmitters. And that's another issue. And that's why these drugs, and this is actually a medical term, they call it poop out syndrome. And that's why these drugs are known to have poop out syndrome, meaning that they work for a while, and then they tend to stop working. And if you don't fix the underlying reason why the neurotransmitters are off, maybe it's iron, maybe it's low vitamin D, low vitamin B6, not enough sleep, all these other issues, it's very hard for people to get off these drugs because we haven't fixed the underlying issues. When I have a patient come in and they're taking medications, especially if they're not having side effects, then the first thing we don't want to do is just take them off medication because they're probably going to feel even worse than they already do. So what we want to do is leave them where they are and start working on the underlying issues and get those as well as we can, get them feeling 100% with the medications they're taking. And then we can start to have the conversation about how to healthily and slowly wean off the medication.
And then what are some of the strategies for that?
Well, let me preface it by saying, anyone listening should definitely not do this on your own, and make sure you work, with a practitioner who's very knowledgeable. And certainly don't just get off any kind of antidepressant or mood stabilizing medications, just blankly get off them, because that's generally not safe. So having said that, like I said, the first step is to really work on all the underlying issues, making sure sleep, exercise, stress, maybe going to therapy, doing some kind of relaxation work, changing the foods, and then doing a fair amount of testing. We want to find out what's going on with iron, red blood cells, B12, vitamin D, B6, inflammatory markers, histamine. I like to look at hormone levels as well, melatonin levels, glutathione level. There's so many things to look at because there's, and what I'll find is that many of them will be just fine, but that there's going to be a number of factors that are out of balance. So then we want to start working on those things. And that's where we can use, maybe a different approach with foods, especially if there's food sensitivities. We want to heal the gut, lower the inflammation, maybe put people on amino acids to start supporting some of the neurotransmitters, put people on blood sugar supportive nutrients to help stabilize blood sugar, whatever I think the underlying issues are. I do a lot of gut and stool testing, and if the microbiota are really out of whack, or if there's a lot of candida and yeast issues, we may want to work on those things.
What are your favorite gut and stool tests?
I've been using GI map tests lately. Yeah. I think that's a good test. I think there's a number of them out there. I think, the Genova testing seems to be very good as well. Vibrant America has a good testing. So,
yep.
Yeah. And, so looking at all the testing we can, trying to adjust the factors that we find that are out of balance. And then once people are on that plan and they're doing better and better and better, then we can start to have the conversation about how do we wean off the medication? Is this a good time? We're going into December here in New York. It's pretty dark. It's getting pretty dark here in New York. And, serotonin levels are at their lowest. So maybe right now isn't the best time to start thinking about getting off SSRIs if we don't need to. If there's a need, then certainly we can. But maybe if we can wait to the spring, that'd be good. So so seasonality might play a role there too.
Maybe you could explain how seasonality affects serotonin and mood.
Yeah. So generally, as the days get shorter and darker, serotonin naturally goes down. I think, as animals, we're designed to hibernate. We're designed to go to bed earlier and sleep longer. And that's the interesting thing about the holidays, right? The holidays put us into needing to be more outgoing and more active than ever at a time when our bodies are looking to be the least outgoing and the least active. So, you combine low serotonin and the stressors of needing to do all those things. And you end up with rates of suicide that are and depression that are much higher during those times of the year than other times. So, and then as the light, becomes longer during the day and the light gets brighter and the light gets more direct in the summer, that also stimulates higher serotonin levels. So generally, people will have much higher serotonin levels in the summer than in the winter. That's one of the reasons why light boxes can be very helpful in supporting people. And I have many of my patients that I'll send little reminder calls in August saying, hey, make sure your light box works, because we're going to want to start using that in a couple of weeks.
And so circadian rhythm, it has a lot to do with cortisol and melatonin. And can you talk a little bit about that? And do you ever do the salivary cortisol testing to take a look at that?
Yeah, I do either salivary or urine tests to look at cortisol levels throughout the day. And in many patients, who are depressed, they might have very high cortisol levels, or they might have very low cortisol levels, or the levels might just be very dysregulated, where maybe they're very low in the morning and very high at night. So you'll have these people who can't get out of bed in the morning, and then they're tired and wired at night and they can't sleep at night. Right. The whole idea of circadian rhythm is very important to mood disorder, and getting people in balance with nature and in balance with the day is a great idea. It's interesting because right now it's 10 after 10 here in New York, and I have this bright light over here right next to me that's on. What a disaster for melatonin levels. Talk about my circadian rhythm, Absolutely. But so it's, that's not a really great decision on my part, right? To have a bright light in the evening when I should be really winding down and having just maybe these amber lights or orange lights on, telling my body this is the time to go to bed. So one night it's okay to do that. But, if you do that many nights, then you start to set a poor circadian pattern, and then maybe add eating late, right? Because eating also stimulates cortisol. So, we're like, it's funny. I got a dog for the first time about 3 years ago, and I never had a dog before, and I brought it to a vet, and the vet said, it's really important for the dog that you feed the dog the same time every day, and that you take the dog out to poop the same time every day, because that's going to make it feel confident. That's going to make it feel safe. And that's, it's going to keep its system calm. And I thought to myself, gosh, that's exactly the same with us human patients, right? Us humans need a regular circadian rhythm when we eat, when we go to the bathroom, when we get up in the morning, when we go to bed at night, when we shut the lights. I mean, all of those things not only, are good for general overall health, but they're really important for our mental health.
Now, is the quality of sleep equally as important as the amount of sleep?
Well, both are certainly important. I mean, the amount of sleep, is going to vary depending on person to person. Generally, most people do need, I think, a good 7.5 to 8 hours. And I think that's been shown. It's also been shown that people who get a lot less sleep or people who get a lot more sleep tend to have more anxiety and depression as well. So there does seem to be a sweet spot for most people around 7.5 to 8 hours.
And somebody asked, what light box do you recommend, and how do you suggest they use it?
Oh gosh, I don't remember the exact name of the Lightbox. I usually send people links to it, and I can't, to tell you the truth, I don't remember. I could tell you though, in general, I remember I recommend a 10,000 lux Lightbox. So lux is LUX. So 10,000 lux, which is the intensity at 30 inches. So if you look for a Lightbox 10,000 lux at 30 inches, or feel free to send me an email and I could send you the links. My email is peter@drpeterbongiorno.com. What was the next question?
Is coffee? Oh, there's another question from me. Somebody just asked a question. Do you see people who are on antidepressants who are more apt to develop seizures?
Do I see people on antidepressants who are more apt to develop seizures? Well, people who are on wellbutrin would be a little more apt to develop seizures. Wellbutrin has been shown to increase seizure rate, and sometimes creates, first seizures in people who've never had seizures before. I don't know. I haven't seen that with the other medications.
Is coffee good or bad for mood?
Well, generally, it depends on the person, right? So people who are anxious, for the most part, tend to do better with less coffee. It will make them more anxious. And people who are typically anxious, who are affected by coffee, usually have a genetic polymorphism that you could even look at to see how well they break down coffee and how long it probably lasts in their system. But the research on depression is fairly clear that people who drink 2 to 4 cups of coffee a day will have lower depression rates than people who drink no coffee to maybe 1 or 2 cups a day. So depression seems to be coffee seems to be protective when it comes to depression rates, although that effect does start to change at around 7 to 8 cups of coffee and actually increases rates of depression and anxiety. So 7 to 8 cups, that's a lot of coffee. I don't recommend that.
Right.
But yeah, 1 to 2 cups, 2 to 4 cups a day for people who are depressed in the research seems to be good. Now, having said that, as a naturopath, as a functional medicine practitioner, I also think about somebody's adrenal glands because, when you drink coffee, it's sort of like squeezing those adrenal glands a little bit. So you'll get more norepinephrine out of it and you'll get the brain to make more dopamine. But if people's adrenals are very, very weak and already depleted and you keep pouring coffee in them, even for depression, that's actually, I think in the long term might be more problematic. So I personally, with my patients, if I run the adrenal test and I see their cortisol is very, very low and their norepinephrine's really, really on the floor, I don't want to just give them coffee to kind of boost them up. I want to actually nutrify them and give them things that will actually nutrify their adrenals so that they get the natural boost that we're looking for. So if they're not very, very depleted, and then I think some coffee can help with the depression. That was a long-winded answer.
That's good. No, thoughtful. Why does it seem like young people are just epidemic with anxiety in particular and also depression?
Mm-hmm. Young people, what ages are you referring to?
I'm referring to, teenagers, but even young adults.
Well, I think there's a couple of reasons. So one is the sleep schedules, and, I was reading some research about teens and it seems like teens actually have a different circadian rhythm than the rest of us.
Really?
Teens would do better to wake up later and go to sleep a little later. And unfortunately, the schedule is really designed to get up really early, right? So you have a teen who really naturally wants to get up later and they have to get up earlier. And then and then in the evening, they don't want to go to sleep, right? Because it actually feels too early for them. So a lot of teens are very sleep deprived as a result.
Now, why would teens be programmed in that way?
I don't have the answer for that, but I've been doing more work on circadian rhythms, and that's one of the things that I learned. And I can't tell you why, but it's something developmentally that, when we're younger, the kids tend to go to bed early and get up early. But then when they get a little older, in their teen years, they tend to, want to go to bed late and want to sleep late. And it's not just a habit, it's actual physiology. And then as we get into adulthood, that starts to shift and we start to want to go to bed a little earlier. So unfortunately, these teens at these very critical years of growing are especially sleep deprived in general, and then even more sleep deprived for their natural circadian rhythm. So I think that's one issue. I think another issue is, is deplorable nutrition. There's a number of studies now that show that, the much higher rates of impulsivity, much higher rates of anxiety, depression in teens who eat fast food and eat a lot of poor quality foods versus teens who eat better quality food under the same circumstances. I have a couple of slides and some lectures where I talk about that, and the really interesting studies that clearly show that. I also think, in my opinion, the screens that we're using in social media is also playing a strong role. I mean, and there's a fair amount of research that's showing that. I mean, look at all the stuff going on in the news right now about Facebook, keeping down some research about the effects it does have on teenagers, especially Instagram when it comes to, self-worth and looking at their selves and comparing them to somebody else and, what the ideal person should look like and act like and how many likes should they have. And all. It's a lot of pressure. And plus, I think just staring at these screens and the blue light that's coming from them is, at night is further exacerbating that sleep issue.
You think the EMFs might also be playing a factor?
Yeah, I'm sure that does play a factor. I mean, more and more research is coming out showing how strong the electromagnetic frequencies are, especially from iPhones, which, so many teens have. Very little to no protection on the screen the whole time, or having it right on their body somewhere, most of the day, if not all the day.
Right. Yeah. So let's go into lab testing. Let's talk about in detail a little bit what you think is a good panel to start with for the average person you're seeing. And I realize everybody's different, and we're going to focus on different things depending upon the history and.
Yeah, no, it's tough. I do in my books, I do have a page where I give, the panels that I generally like to see, because it is important. And I'll tell patients, or my readers, if, it's a page you can take out of the book or copy and hand it to your doctor. And hopefully he or she will, be able to run most of those. It is different for everyone. When I think about running labs, I like to look at, blood sugar, so hemoglobin A1C, insulin, fasting insulin, I think is very important. Red blood cells, white blood cells, a liver panel, GGT, which can look at, can be a surrogate marker for toxicities as well. And a full iron panel with ferritin, as we talked about before, a full thyroid panel, including thyroid antibodies, inflammatory markers, so things like erythrocyte sedimentation rate, C-reactive protein, interleukin 6, especially if there's depression, looking at gut markers, looking at things like fecal calprotectin if I suspect there's colitis, looking at celiac panel as well, amylase and lipase if I think there's pancreatic involvement, and then looking at vitamins, vitamin D, zinc, the zinc to copper ratio, red blood cell magnesium, vitamin B12, methylmalonic acid, which also looks at B12 in a different way. So I mean, there's so many. Yeah,
about
go on and on with that.
Importance of lipids, looking at detailed lipid panel.
Yeah. So detailed lipid panel, especially if I think there's a lot of cardiovascular involvement, and lipids not only to check to see if cholesterol is high, but oftentimes to see if cholesterol is too low. Especially if people are on statin medications, because cholesterol is the precursor molecule to pregnenolone, which I also check on labs. And pregnenolone is the precursor molecule to all our other important steroid molecules, cortisol through one pathway and progesterone, and then DHEA and testosterone and estrogens through another pathway. And so I do worry for so many patients when their cholesterol is too low that they're not going to have the ability to make all of those other hormones that we really need for good mental health.
And there's a big push in cardiology to get the LDL
lower and lower,
as low as possible.
Right, because we look at one pathway and one mechanism, and we don't think about everything else. It's
and yet they say there's no research to show that statins have any negative effect on brain health.
Yeah, it doesn't make sense, and and I think what happens is when ideas are new, kind of the pendulum swings one way, and then as more and more research comes aboard and we start to see, oh, you know what, maybe this isn't the right way we're thinking about it. I mean, how many times have we seen this, right? We've seen this with when they demonize fats. We see this with margarine when margarine was supposed to be so healthy for us,
right?
Things like that, and then we kind of go, oh, yeah, it's not really working out as well as we could have. So
now, what about the importance of hormones?
Yeah, so hormones are critical to mental health. For example, estrogen levels really play an important role in the levels of serotonin in the brain and whether serotonin is being made in the brain areas that need it. Estrogen is when estrogen levels are high, it changes the amount of monoamine oxidase, right? So to help keep serotonin levels high. Progesterone actually does the exact opposite when progesterone levels. So that's why estrogen and progesterone have a nice yin and yang to them because they kind of balance each other. So looking at not only estrogen levels, but the balance of estrogen and progesterone in a woman is very important. Estrogen levels are actually important in men. Men have 6 times the level of estrogen in the brain that women do. So sometimes when we think about depression and serotonin, we also want to check on estrogen as well.
So let's talk about estrogen levels in men. Is there a number that, do you like to see estrogen above 30, or is there a certain number you like to see? And is there any importance of progesterone levels in men?
Mm-hmm. Progesterone levels in men, there isn't a whole lot of research on. It's something I've thought about. And I do know when men are supplemented with progesterone, typically it's not beneficial. That's what I've seen so far, but it's an interesting question. And I think it needs a lot more explanation and exploration. As far as estrogen levels, the way I think about it is, we want to look at levels of cholesterol, pregnenolone, DHEA, then testosterone, and then estrogen, and basically that whole pathway should kind of feed each other very nicely up until the last, up until the estrogens. And so if that pathway looks healthy in general, then I think we're on the right path with men and women. Right.
Okay. So let's talk about what about if you have a menopausal woman who's having a tough time with depression and anxiety. Do you ever recommend hormone replacement therapy?
Possibly. I don't typically like to start with hormone replacement therapy.
Right.
So first we want to start with, obviously if someone's really suffering and the hormones are so out of balance and they need something to help them feel better faster, then I would certainly consider hormone replacement. But in general, first we start with all the basics, sleep, exercise, diet, stress reduction, because those things oftentimes will help. Secondly, we want to support her liver. Because the liver is what processes the estrogens. And oftentimes when the liver and the microbiome are out of balance, we're going to see improper levels of estrogen. For example, if there's if beta glucuronidase levels are out of balance, that's going to change estrogens. And there's going to be a lot more recirculation of excess estrogens. If there's a lot of candida acts as false estrogen. So that's going to change the balance of estrogen. So we want to fix all of those things. So without even touching hormones, we can oftentimes fix the hormones,
right? By fixing the gut.
So right, exactly, by fixing the gut. And then, if, making sure a woman is having bowel movements every day to making sure, so everything is getting out that needs to get out from the liver. And then if those things aren't enough, then we can test hormones and see where they are, and then make a decision about whether we want to tweak hormones a little bit. If pregnenolone is low and all the other hormones are low, then maybe start with a touch of pregnenolone, and that can help feed the rest of the pathways. Or if we see that cortisol levels are actually normal or normal high, but the other side of the pathway, DHEA, is low, then maybe we'll start with DHEA and see if we could feed the pathway. So I try to, feed the pathway earlier so that the body has more ability to make the decisions it needs to make.
Right. So you might start with pregnenolone versus estrogen, progesterone.
Possibly. And I did want to say there's there's an herb that I might try before either of those, especially if progesterone levels are low related to estrogen. And that's Vitex.
Right.
Also known as chasteberry, which does a beautiful job. There's studies in premenstrual dysphoric disorder showing it works really well. There's other studies in perimenopausal depression showing that it works just as well as SSRIs. Although it does seem that that the Vitex seems to work better for the physical symptoms along with the depression, whereas the SSRIs, at least in this one study, showed it was better. The SSRI was a little more helpful when it came to the mood symptoms versus the physical symptoms. So oftentimes when I'm using Vitex, I'll use Vitex along with tryptophan, and I find we can get both the mood and the physical symptoms in balance. So Vitex is a brilliant herb. It's really wonderful.
What kind of dosage do you find effective for Vitex and also for tryptophan?
Sure. I think so. Vitex, I think it'll depend on what kind of, if it's an extract or what kind of preparation it is. Typically, it's a capsule is like around 220 milligrams. So I'll usually start with 1 or 2 of those a day, and I'll do it every day. I won't dose it with the cycle, but I'll just dose it every day. And then as far as tryptophan goes, if it's tryptophan, I'll usually start with 500 milligrams twice a day, and 5-HTP maybe start with 50 to 100 milligrams a day.
In which you find more effective, 5-HTP or tryptophan?
That's a great question. And, it's interesting because theoretically, 5-HTP should work better. It's a little further
downstream, right? Yeah,
it's a little further down on the pathway. And especially if there's inflammation, it should be harder for your body to make serotonin from tryptophan than it should be from 5-HTP. But having said that, I find different patients respond differently. Oftentimes I start with tryptophan because I think I find it does work better, although not in every case. So it's, And especially for sleep, for helping people stay asleep, I tend to use more tryptophan. So having said that, I'm always open because everyone's different.
Dr. Wasserman asked a question about diet, and I think what he's asking is, you mentioned somebody having too many simple carbs, but can a low carb diet also increase problems with anxiety and depression?
Great. That's a great question. That's absolutely true. There are many people, because we need carbs to help make serotonin as well. And a very, very low carb diet and someone who's susceptible can send them into anxiety and depression by lowering their serotonin levels. Some people who aren't that affected, they can go very low carb, do a keto diet, and their brain's doing wonderfully. But you're absolutely right that we have to be careful, especially people who teeter in depression and suicide, to put them on a low carb diet can actually lower their serotonin levels more and put them more into that mood disorder than they already are. The other thing I've seen in relation to that is gluten can also play a role in mood, and people who come in depressed are often sensitive to gluten. Having said that, if you take them off gluten, gluten also creates these kind of morphine-like compounds in the body, and they affect the brain. And sometimes if you put people on a gluten-free diet very quickly, it's almost like taking somebody off of morphine. And when they go through withdrawal, their symptoms will actually be even worse. So I do find if people are depressed or they have pretty significant mood disorder, and we decide to take them off gluten, I do it slowly. I don't have them come off of gluten right away all at once. I have them do it slowly, and I treat it like any other drug that they might be addicted to, because I know we're going to have withdrawal symptoms as well.
Interesting. That's a good clinical pearl right there. I mean, there's been tons of clinical pearls tonight already, but so let's go into the most effective supplements for depression and anxiety. And I know you've mentioned a number of them already, but let's start with fatty acids.
Mm-hmm. Yeah. So essential fatty acids, I think, fish oil by themselves, I don't think can cure depression or anxiety in most cases, unless people are just so genuinely deficient in them, which a lot of us are. There's a study that came out last August in one of the psychiatry journals showing that patients who are treatment resistant to SSRIs tended to do much better when they took fish oils. And now that also made me think, well, maybe if you just gave them the fish oils, they didn't even need the SSRIs. So, but yeah, I mean, certainly, essential fats play such a strong role in creating healthy membranes, and healthy membranes in the nervous system are going to play such a strong role in mental health. So to me, fish oil is one of the basics. So, when a patient comes in for a first visit, like I had a young woman who came in today with anxiety. She doesn't prefer fish. She doesn't like to eat fish. And we're going to run some tests and do some of the things that we talked about. But I already put her on fish oil, unless I know a person's allergic to fish. If they're not really eating any fish and they're not taking any fish oil, that's an easy one to have them start taking some fish oil, because I know in the long term that's going to help.
What do you think about SPMs, which are those derivatives from fish oil that help to reduce inflammation?
Oh, are those the resolvents? Is that the same as
exactly,
resolvent? Yeah. There's a lot of good, a lot of intriguing information about that. And and my understanding is, and I haven't used them a lot, so I don't have firsthand experience with them yet. I just actually started bringing them into the practice. Okay. And I'm going to be taking them myself because I like to try everything first. And, but my understanding is not only does it help with, inflammation, it also helps with the healing process as well, which I think is amazing. So I've been reading the literature on that, and I think there's some substantial information there, and I could see why a number of companies have been working on bringing those out. GLA. Yeah. So I talk about in my books the importance of GLA, especially in production of prostaglandins, which are those are also feel-good molecules that our body naturally makes. And there's a number of studies in people who are alcoholics. Alcoholics generally drink alcohol because it increases levels of PGE2, which helps them temporarily feel happier. And giving people GLA can be an important part of helping the body make its own prostaglandins and helping mood as well. So, for example, when I see patients who have a strong alcoholic intake and that's one of their drugs of choice to feel happier temporarily, I will start them on GLA.
I think GLA is an interesting example of not throwing the baby out with the bathwater. It's been so much focus on omega-3s and the fact that omega-6s are too high, so we got to get the omega-6s low. And I've talked to doctors who said, why would you ever prescribe an omega-6? And of course, GLA and evening primrose oil, these are omega-6s, but
that's right.
They have important benefits too.
Yeah. In fact, typically the ratio of omega-6 to omega-3 should be, 3 or 4 or greater or something like that. So a healthy diet does have more omega-6s in the diet than omega-3s. It's just, I think so many of us are so deficient in omega-3 right.
Yeah, there's some debate as to what the ideal is. Some of the labs say under 4. I know some people say it should be under 2. There's discussions of, the cavemen were really 1-to-1. So,
it's funny. I'm scrolling right now. I'm reviewing a book for a friend of mine I was putting out a book, a medical doctor's putting out a book on skin health. And I was just reading the section on omega-6s to omega-3, and he put out the latest research. Dr. Mark Tager, I don't know if you know him, a wonderful guy. He's got a book coming out on skin health, and I don't know if I can find it offhand, but I was just reading that on the train coming back, reviewing his book. So,
okay. So, what about probiotics?
So probiotics, it's again, the first step to a healthy gut is certainly reducing stress, getting enough sleep, exercising, eating the right foods, eating enough fiber, right? So probiotics by themselves can be helpful, especially when therapeutically, like if there's, diarrhea, if there's high levels of C. difficile, for example, using individual probiotics can be useful for balancing things. But overall, to really create a healthy microbiome, we want to do all those other basics first.
Now, of course, there's probiotics on the market that are marketed as specifically being beneficial for depression and anxiety.
Right. Yeah. And there are a couple of studies, and I remember when those first ones came out, there was a company that came out with a line, and there was one study, and I tell you, the research on the microbiome, the microbiota, and probiotics have just exploded in the past couple of years. Right. So I think there's more and more coming out about that. And now there's studies showing that, in animals, if you take an animal who's depressed and you take the fecal, you do a fecal transplant from an animal who's not depressed, and that you can actually lift their mood and their depression. So there's definitely something there. There's no question about it. Whether we can get all the strains into a capsule that we can take in and actually help repopulate, I think that still remains to be seen. But if we can get some of the keystone strains in there and get the right fibers, and again, work on people's stress and all the other basic factors, I think it does make a difference. And I certainly use probiotics as part of the regimen when I work with my patients.
And some of the keystone species are starting to become available. I interviewed a researcher company, Pendulum Therapeutics, has I think it's the first anaerobic Akkermansia.
Yeah, I saw that. Yeah, that's interesting to me. And again, is giving an individual one like that the most beneficial? Maybe. I think of the microbiota as a kind of like a garden in there,
Right.
And so we have tomato plants, and we have zucchini, and we have peppers, and maybe some cucumbers on the bottom, and and then we have the weeds, maybe the ones we don't want in there at too great a level. Right. And some of those we can put in a capsule and give to people, and some of them we just can't. Right. So we have to do it through fermented foods, and we have to do it through, just making sure people are getting
fiber and prebiotics. Yeah.
Right. So it's, there's so much we need to learn, but I think it's really fascinating, and, I'm interested.
How about the importance of B vitamins, including folic acid?
Yeah. So B vitamins, especially for mitochondrial function, for producing energy in the body, for methylation, which we need to make neurotransmitters, which we need to break down neurotransmitters and break down hormones properly. So we need those B vitamins, and in different levels, and they're certainly worth checking as well. And, if I know somebody's very, very stressed out, it's usually a safe bet to put them on a low dose B complex, at least to start, because they're burning through those B vitamins.
I remember there being some research on folic acid, maybe helping patients with schizophrenia, By the way, have you found it effective to use a functional medicine approach for patients with schizophrenia?
And yeah, I mean, absolutely. Probably even more so,
Okay.
Because, in conventional care, schizophrenia is really about just lowering levels of neurotransmitters, right? So if we could understand what are the blockages of why maybe people aren't breaking those things down in their own brain and using that information, then yeah, absolutely. So, the first step is, again, all of the basics. There's, research now in schizophrenia is also showing a lot of mitochondrial dysfunction, a lot of psychotic mental health disorders may have to do with the mitochondrial dysfunction. So that's certainly a place I think about when I think about working, with patients who have schizophrenia.
And what are your first thoughts about trying to improve the mitochondria?
I guess I want to first think about, well, what is, why is their function impaired?
Right.
So we think, it could be toxicity, it could be heavy metals, could be too much iron in their body.
Right.
It could be very high insulin levels due to high blood sugar. It could be high adrenaline, norepinephrine and epinephrine levels due to stress. There's a number of reasons why mitochondrial dysfunction can start. Too much inflammation in the body can certainly contribute as well. So we want to look at all of those factors and key in on which one of those are probably most likely for that particular person. There can be genetic influences too, although, and so when I think about people who have had mental health concerns since they were very, very young, like 3, 4, 5 years old, then I think, well, maybe it's more of a genetic component in terms of mitochondrial function. Not that we can't help them, but that it's probably less environmental and more genetic. But if it's people, who the mental health concerns started happening in their late teens and certainly in adulthood, then I think about it more as a secondary mitochondrial function based on those other factors.
What kind of testing for heavy metals and or other environmental toxins have you found helpful?
Mm-hmm. Well, I mean, the first place to start is a blood test, to look for things like mercury and cadmium and arsenic and lead and aluminum and things like that. And the problem with blood tests is that you're not really seeing what's going on with body burden, right, but you are seeing what's going on acutely. So if you find high levels acutely, then you have to start working on that. And then doing urine, you could do urine tests, provocated urine tests to try to find out what really the body burden is after that.
For years, I know we used to use the DMSA and do provocation testing, and now that's prescription only, it's such a pain. Is there a workaround? Have you found anything like can you use glutathione or anything like that?
I mean, I really haven't. Not something I think I know would be really reliable.
Okay.
So I'd be interested if anyone listening has, but. I haven't. Yeah, no, still DMSA, that seems to be the DMPS seems to be the best way to go.
Right.
Yeah, it was nice when the supplement companies had them, right? And we just used them. Check kidney function first. If that's okay, then, do a provocated urine.
Right.
Right. They're making it harder and harder.
Importance of vitamin D.
Yeah, so vitamin D, it's has so many pleiotropic effects in the body. It's needed for serotonin production, certainly. So when vitamin D levels are lower, it's going to be harder for the body to make serotonin and other neurotransmitters. And then it's very important in how we balance inflammation in the body. So that's another point. It's a neurosteroid, so the neurosteroids, pregnenolone, DHEA, and vitamin D, when any of or all of those are low, there's some really fascinating research that shows the communication between the amygdala, which is the fear center of the brain, and the prefrontal cortex change significantly and creates a lot more likelihood of anxiety and depression. So when neurosteroid levels are high enough, like vitamin D should be, then there's going to be a less likelihood of things like anxiety.
Minerals like magnesium, zinc, lithium.
Yeah, I'm for them. I'm for all of them. So magnesium, is very relaxing. It's important. It has so many levels of importance. If I had to pick one in terms of what we're talking about, GABA levels in the brain, it helps with the benzodiazepine receptors. Zinc, the zinc to copper ratio, looking at zinc levels, as a cofactor for so many different reactions in the body, certainly for gut health as well. And then, you mentioned lithium, nutritional lithium.
Right.
Actually, I just wrote a paper on nutritional lithium that was published in the Natural Medicine Journal. I'd be happy to send it to anybody
that'd be great.
If anybody would like a copy of it. And also, anyone listening, please do join me on Facebook and Twitter and Instagram as well. And if you want to be on my newsletter, feel free to send me a note. I'm putting out a mental health newsletter, so I'd be happy to send it out. Won't be selling you anything. It's just purely research as I read it, things that I'm excited about, I like to send to my friends. So
it's great.
Yeah. So nutritional lithium, I found very, very helpful in my practice. I've probably been using it for about 9 years. And it's great for teens with impulsivity, even younger kids, in the 5 to 10 age group. It can really be helpful for anxiety and drop doses. Very supportive of the brain. Now there's even research showing it may be protective for Alzheimer's later on. So I do use a fair amount of it with patients, and I'm finding good results.
So this is the lithium orotate, right?
Lithium orotate. Yep.
And what kind of dosage do you find effective?
I usually start with 5 milligrams, for an adult, maybe 1 milligram for a child.
Okay.
Yeah. Up to 20 milligrams a day in an adult.
What about GABA?
GABA, the supplement?
Yeah.
Yeah, no, GABA can also be helpful. Some people theorize that GABA is only useful if you have a leaky gut and a leaky brain, because it's very difficult to get into the brain.
Right.
I haven't seen enough leaky gut patients versus non-leaky gut patients that I've tested to know for sure whether that's true. My theory is if you give enough, hopefully some of it will get through. So usually at least, 500 to 1,000 milligrams, 2 or 3 times a day. So if I'm using GABA, I tend to dose it high. I find low doses don't typically do a whole lot by itself. I'll often give it with theanine and maybe with, something like lithium orotate or CBD oil. So usually I'm using a few things together. But I do find, especially for patients who are very susceptible to the side effects of benzodiazepines, you really want to think about using other, gentler things like GABA. And oftentimes you can even find a better result because it'll help calm people down, but you won't have the side effects.
And there's a few different forms of GABA on the market. I know there's GABA chewables. There's GABA that supposedly is better absorbed.
Yeah. I've been using liposomal GABA, the kind that you can kind of spray.
Okay.
And I've been finding good results with that. I've heard chewables can be useful too. I haven't used them. Okay. So, but I guess it'd be the same effect, right? Using a chewable, you're kind of getting it into the oral cavity and getting absorbed through there. So that would make sense to me.
And I guess, theoretically, if you kept it under your tongue and helped it, let it dissolve there. What about any of the other herbs? And then I think we're going to wrap it up in a couple of minutes.
Yeah, I mean, it's other herbs. I mean, I know that it sounds cliche at this point, but St. John's wort is a very good herb for mood, especially for depression, and it does work for anxiety.
Why has it been given almost a bad name?
I think because it's known to affect the liver and its ability to process other drugs. So I've done some formulations for companies, and I have one formulation to support neurotransmitters and for depression, and I purposely didn't put St. John's wort in it because I know, it won't be used. So when I use it in my practice, I actually use St. John's wort separately with it because it does affect a lot of drugs more than others. So I think a lot of practitioners tend to stay away from it. I've had a patient, I had one patient who came in, she took St. John's wort on birth control and she got pregnant because it stopped. There is a reason, it turned out she had twins and was very happy about that in the end.
St. John's wort worked out makes it easy to get pregnant.
But I like St. John's wort, especially now in the time of COVID, because it's a good antiviral. It has anti-inflammatory effects. Plus it's really great for mood. It's, it's a beautiful herb.
And you mentioned using lavender. You also listed rhodiola and saffron in your book.
Mm-hmm. Yeah. So saffron, especially when there's a lot of digestive issues. I have another formulation that I put together, and it has chromium, saffron, turmeric, berberines in it. And a little bit of rhodiola. And the idea of that is to kind of address blood sugar, gut inflammation, hypothalamic pituitary adrenal axis, and the berberines to kind of help promote neurotransmitters in a healthy way as well as helping the gut.
How does berberine promote neurotransmitters?
So berberines, it's not something that's well discussed, but berberine actually binds to sigma-1 receptors, which help this pathway of chaperone proteins, which also help neurotransmitter production in the brain too. So it is known to help. Wow. Yeah. So yeah, berberines an
incredible herb, Yeah. I mean,
cholesterol, blood sugar.
Yeah. I mean,
gut health.
It's a natural form of metformin. So, right. I use it for anti-aging purposes as well.
Yeah, I remember learning about it in school again 25 years ago. And, the only thing I remember learning about it was that it was a good natural antibiotic and kind of helped the gut heal at the same time. Right. Yes. And now it's just so much more. It's great.
And probably the other wonder nutrient is NAC, which, you mentioned in your book and seems to be beneficial for almost everything.
Yeah. And NAC is so good that Amazon has taken it off their website. That's how good it is. So,
well,
which tells you it's pushing some buttons, right?
Well, I think the reason they did it is because when it was first approved, it was approved as a drug.
Right.
So hopefully the FDA is not going to take it off the market. I mean, even though Amazon, I'm to be honest with you, if Amazon said they were going to take all the supplements off of Amazon, I'd be quite happy.
That's fine with me. Yeah.
Can I just pipe in on that for a second on the back, the NAC thing? So we think it's not a thing. We are not stopping making it. We will continue to make it.
Great.
There was one study like in the early 60s that they're trying to say is the reason that they think it might be a drug, but they haven't changed any regulations or any classifications or anything like that. It was just a bunch of warning letters last fall. The Amazon, because they're a forward-facing, a retail-facing company, that's why they did it. And then Whole Foods Market is owned by Amazon, so they did it. And then Thorne is kind of the supplement company that got caught up in it because they pretty much only do Amazon now. So that's where kind of the ball got rolling, but it's another one of those, mostly it's an internet thing. And we are selling it like crazy. Like we literally can't make it fast enough. Something to the tune of about 5,000 bottles a month.
Wow.
So but it's not going away. We were not worried about it at all. So, and we have a great one. It's super inexpensive, 600 milligrams per cap. Check it out.
So, maybe we could come up with a strategy to get Amazon to take more supplements off their website.
Yeah. I just wanted to say, Steve, I really love the cortisol manager. I find it also works quite well for my patients when cortisol levels are high. And it's something I've been using for a number of years. Is really good success too.
Thank you. It's by far our biggest selling product. It also happens to be Natural Partners' biggest selling product, and probably Emerson too. So it's definitely our flagship for sure. So.
And you guys also have a brain product that has saffron in it.
Yeah, so that one's pretty new. It's called Neurologics. I don't know if you've seen it yet, but it's a combination of spearmint, saffron, and a branded citicoline. So it's a pretty big anti-inflammatory part. You know, the spearmint and citicoline part work functionally and structurally, but the saffron is kind of an added thing because we feel like the mood is part of all of that. And the individual ingredients have been shown to working memory, sustained attention, focus, some pretty impressive studies on the stuff. So it's not cheap because it's one of the ones that doesn't have caffeine in it. So it's not a stimulant, but it blows people's doors off. And that's another one. We have 7-day trial bottles of, and people will notice it after 7 days, and we're happy to let them try it because we know it works. So Neurologics.
Okay. Thanks, Steve.
Yep.
So Peter, this has been incredible. You've provided us with so much great information. Any closing thoughts?
Yeah, I mean, to the clinicians out there, just, when you have a patient who, especially if it's a challenging patient, always double down on the on the basics, make sure that those are all taken care of, and just really look for the other underlying factors that maybe you haven't looked into yet, because there's some reason why a person is feeling the way they're feeling. And it's really up to us as clinicians to kind of look at all those factors and really put it together, because there's, practically always a way to help to get people to feel better. If not get them off medications, at least get the medication doses lowered, which often could be a win, especially in things like bipolar. You're creating so much less toxicity in the body. And to any listeners there, in the public who are suffering from anxiety, depression, mental health, just know that there's still a lot of tools out there, and find a practitioner who just really cares and is listening and wants to look into those underlying factors, because there's always something else that can be done. And just don't give up hope, and don't give up, thinking that you can feel better and feel like your best self.
Thank you.
Yeah. Thank you. Thank you so much for what you do and bringing these forums to people.
Great. Thank you. And we'll see everybody in the new year. Thank you for making it all the way through this episode of the Rational Wellness Podcast. And if you enjoyed this podcast, please go to Apple Podcasts and give us a 5-star ratings and review. That way more people will be able to find this Rational Wellness Podcast when they're searching for health podcasts. And I wanted to let everybody know that I do now have a few openings for new nutritional consultations for patients at my Santa Monica Weitz Sports Chiropractic and Nutrition Clinic. So if you're interested, please call my office, 310-395-3111, and sign up for one of the few remaining slots for a comprehensive nutritional consultation with Dr. Ben Weitz. Thank you, and see you next week.